Impression materials and technique for removable partial denture. The impression regarded as the negative replica of the teeth and edentulous area of removable partial denture. There is two types of impression techniques that used in the construction of removable partial denture. The first type of technique is the primary impression technique. The primary impression technique used for make the diagnostic cast and make the cast for the purpose of the special tray for the secondary impression technique or the final impression technique. Final impression technique or secondary definitive impression is classified into the conventional technique, selective pressure technique, functional dowel impression technique, and reline and revise technique. For the conventional technique or called the anatomical or mucostatic impression technique, it's used for mostly the bounded area of or the Kennedy class 3 classification. It's take the impression for the bridge border or bridge contour under normal anatomical case without any occlusal force. While the selective pressure technique is used a selective pressure in some area of the alveolar ridge or increase the pressure in area that is a stress bearing area, while the other area which are not stress bearing area there is no finger pressure on it during taking the impression. And for making the selective pressure or increase the pressure on the stress bearing area of the denture, we make the relief or in the special tray during impression technique or impression taking. The functional dowel impression meaning taking two impression. The first impression is the anatomical impression or mucostatic impression, and the second impression is the functional impression. The difference between the anatomical impression and functional impression meaning that the anatomical impression is taking the impression of the alveolar ridge without any occlusal force, while the physiological or functional impression meaning taking or making the impression for the edentulous ridge under the occlusal force. For the functional dowel impression technique, there is many types of it, which include the McLean technique, Handel's modification, functional relining method, and fluid wax. In case of the McLean technique, the functional impression is taken for the edentulous ridge or the free end extension or the saddle area of the removable partial denture. That means the functional dowel technique is used mostly in case of class 1 and class 2 Kennedy classification. The second impression is made over the functional impression and it records the structure in their anatomical form. That means in case of McLean technique, first of all make a record base with bite rim. The record base and bite rim used to apply an occlusal force during taking the impression. The base plate of the bite rim is filled with the impression material and put inside the patient mouth, then instruct the patient to bite on the bite rim to make a functional impression or physiological impression for the free saddle area or the free extension of class 2 or class 1 Kennedy classification cases as in this picture. Then putting after completing the functional impression of the free saddle, as here, putting the record base inside the patient mouth and taking hydrocolloid impression or alginate impression in a mucostatic state or anatomical impression secondary over the first impression, which is made by the occlusal rim. The second impression is called the pickup impression because it's record the occlusal rim in addition to the teeth under the finger pressure and in a mucostatic technique. Then picking the first functional impression with the teeth. This is the McLean technique, regarded as one of the types of the dowel impression technique. The second type of the functional dowel impression technique is the Handel's modification. It's a modification for the McLean's technique. In this case, the occlusal rim also used as an impression or impression base or impression tray for the functional impression, and the stock tray make a window through it to using the finger pressure on the occlusal rim by the second impression. Firstly, loading the base plate of the bite rim with the impression material such as the zinc oxide eugenol to making the recording of the saddle area or the free end extension. Then by using of alginate filling the stock tray, which have a window inside it, to take the super impression or pickup impression in a mucostatic technique and make a dowel impression. The Handel's modification using of the finger pressure, not the occlusal pressure, by applying the fingers on the occlusal rim or instruct the patient to bite on the occlusal rim after taking the mucostatic impression by the second impression. The third type of the dowel impression technique is the functional relining method or the altered cast technique. In the altered cast technique, first of all, make a refractory cast. The refractory cast is the second cast is duplicated from the master cast of the removable partial denture. The refractory cast used for making the framework or the metal framework of the cobalt chromium removable partial denture. Then to the free end of the cobalt chromium, making a record base, and by using of record base we can reline the occlusal base, the acrylic base plate of free end to taking a functional impression for the saddle area under the pressure of the hand. And in this case, the framework is seated to its final position after loading of the acrylic base plate with zinc oxide eugenol material, or reline the acrylic base plate of a framework with polysulfide material, taking the functional impression for the free saddle area. Then to making the altered cast, the problem with a dowel impression technique that there is a continuous pressure on the free saddle area, and this causes increasing the resorption of the alveolar ridge because it's under pressure at all time when the removable partial denture is intraorally. The type of impression material can be classified into many types. One of it is the rigid impression material. The rigid impression material include the impression plaster, which is a type of plaster of Paris that used in the recording or making impression for the free end extension or in edentulous, completely edentulous patient. And in this case, the impression plaster should be used in cases of primary impression in a mucostatic impression or anatomical impression, and there is no bony undercut, so mostly used to record the maxillofacial relationship and recording impression of edentulous area without any bony undercut. The other type of rigid impression material is the zinc oxide eugenol or metallic oxide based material, and mostly used in the secondary impression or functional impression of the free saddle area, as in this picture. Let's record the free saddle area, and cannot used in the on the teeth because it's difficult to remove from the patient mouth. So it's used for the recording of the free extension area of the edentulous patient, partially edentulous patient, on a special tray or custom acrylic tray, and in addition to the relining of distal extension of the partial denture. The other type of the impression material is the thermoplastic impression material. Thermoplastic impression material have poor details of the edentulous or partially edentulous patient, so it's mostly used in the primary impressions and include the modeling plastic material. The modeling plastic material is provided in two forms, as a brown cake or called the impression compound, and tracing sticks, which is used in the border molding of the border of the special tray, especially in the free extension. The other type of thermoplastic impression material is the impression wax and natural resin. Mostly the impression wax used as a corrective impression material for the other impression material. The elastomeric impression material also used mostly in the primary impression as the polyether, additional polymerized silicone, condensation polymerized silicone, while the polysulfide is mostly used secondary corrected or in altered cast impression used or in dowel impression technique. The hydrocolloid impression material, it's two types, the reversible hydrocolloid and irreversible hydrocolloid. The hydrocolloid depend on its reaction uh, on the reaction between the material and the water to make good mixing and good qualities. The reversible hydrocolloid it's represent the agar-agar, and the agar-agar material, it's characterized by it's affected by the temperature. So when the high temperature applied on this material by this oven, it's uh, changed to a fluid material, and when the temperature is decreased, the material is changed to a gel form, and it's mostly the agar-agar material have a poor details of the impression making, so mostly it's used in a cooling tray for making the refractory cast for the construction of the framework of removable partial denture. The irreversible hydrocolloid is mostly the alginate. The alginate is widely used by the dentist because it is easily to handling and inexpensive and mostly not need for any assistance for making the impression. So the alginate is mostly used in the diagnostic cast, an orthodontic treatment cast, and in making the master cast of the removable partial denture and the mucostatic or anatomical impression case. The alginate have a side effect or disadvantage. The disadvantage of the alginate is the synersis. That means the impression material after setting or alginate impression material after setting, it will lose its fluid, and the losing of its fluid in a short period of time causing inaccuracy or effect on the accuracy of the master cast. So the alginate should be poured with the plaster or stone as soon as possible to prevent the losing of fluid from it and changing on the details of the impression. In addition, when the impression material uh, immersed in water or in disinfectant is causing imbibition result, and the imbibition result because of immersion in water may be causing expansion of the alginate material and inaccuracy of the impression and cast. Thank you.